Hello, my name is Ulysses, and my topic is the 2009 H1N1 Pandemic. Step 1 Background. H1N1 is a respiratory disease caused by influenza virus. It affects the respiratory tract of the pig and can be transmitted to humans. Symptoms of H1N1 include muscle pain, dry cough, diarrhea, nausea, vomiting, fatigue, fever, and shortness of breath. It is an airborne virus. The disease is not contracted from eating pork. The outbreak of the disease occurred in 2009. The first case of H1N1 occurred in North America in April of 2009. And by June 2009, 74 countries and territories were confirming the disease. The antiviral drugs oseltamivir and zanamivir were used in the vaccine, which was developed during the later in the year. Step 2 Current situation. Strength of the outbreak was that a vaccine was able to be developed. Weakness was that the H1N1 virus was a combination of influenza viruses. This made it hard for scientists and researchers to pinpoint an effective vaccine. Opportunities that arose from the H1N1 pandemic was a wake-up call for an importance of communications. Threats were that thousands of people getting infected and dying, and thousands of more people could have died or been infected if a vaccine was not developed. Step 3 Prioritize core issues. The influenza virus is transmitted from pigs. Mutations allowed for it to be transmittable to humans. It is a contagious airborne disease, can easily be transmittable. The disease lasts 3 to 7 days. Serious cases can last 9 to 10 days. One of the core issues that arose during the pandemic was communication trouble between public health authorities, healthcare providers, and the public. Public health authorities were struggling with information and guidance, as it was frequently changing. Healthcare providers struggled with changing information about upcoming vaccine supply, communicating with physicians, and priority groups. There was a struggle with providing the public relevant information. Step 4 Analyze alternatives. The public health communication model fits best for this situation. One of my alternative approaches will be to continue monitorization of H1N1 virus and other viruses like it, since it is a mutable disease that has the potential to infect other animals or become resistant to current vaccines. My second alternative approach would be to improve communication. Communication was a huge problem between public health agencies, public and health care providers. I would suggest for the public health agencies that are doing the research to send their research and data to a specific agency. From there, that agency would make the final decision and inform the public. Step 5 Recommendations. My first recommendation will be to develop an extensive pre-planned strategies for pandemics. Prepare for worst-case scenarios. My second recommendation will be to develop endemic kits, supplies that will contain items like masks, thermometers, and other emergency items. Step 6 Action Plan. Government officials should put fundings towards public health agencies that would help in research development, plan development, and endemic kits. A goal should be made by 2020. Already have begun the development of research, plan development, and endemic kits. By 2022, have supply heavily populated cities with these endemic kits. By 2026, have an emergency plan for in case of a disease outbreak. These emergency plans should be taught and practiced in every major hospital. And the final goal by 2030, have endemic kits and set emergency plans located in every hospital. and my opinion. Well, I would always see emergency kits at stores, buses, and even at work. I would never think much of them because I didn't see them as essential or important. But I was involved in an injury where I had injured my knee and elbow, blood was everywhere, and infection was beginning to commence. But luckily, one of my friends had an emergency kit and was able to treat me, preventing further infection. Well, since that incident, I've always carried an emergency kit in my backpack just in case I or someone else would need it. Thank you.